to order. First item is approval of the minutes, which you all received.
I make a motion to approve the minutes as presented.
Second. All in favor?
Aye.
Against? Motion carries. Our health officer is on leave today, and so we have I will report one thing, Dan. I think just know that we knew that we'd have rabies in our bat population in Wayne
Yeah,
County.
I've got that part of the conversation.
I got the health officer, that's one thing up.
That's what I was gonna have Dave talk about today, yes.
Anything on Mpox either? Nothing on Mpox.
The news hasn't reported any cases in this country. They've reported, like, maybe Sweden had a case, but I think it's still mostly isolated to the Congo. But it is now more contagious, and apparently they're having more trouble with children contracting it in Africa. So what I've read is they're hoping to get enough vaccine. What typically the strategy is to flood an area around an area that's with vaccine to try to stop it. But whether that will work or how well that's going, I don't know.
I was actually in Spain on vacation this past couple of weeks, and they were talking about it on the news. It was interesting.
Did they report any in Spain, or were they basically saying
They
it's
were
still in
just
Africa?
saying this is in Africa, and exactly what you said about vaccines.
You ready?
Okay.
Right. So I'm doing this just touch different. So a lot of things that normally be printed, I'm just gonna put up on the screen so we don't have a bunch of folders full of paperwork.
Okay.
So we'll start off with Health First Indiana. We're waiting for a signed contract from Purdue. And you should have that in your printed folder. Some revisions made to that contract, our original contract that the board approved and signed and the commissioners approved and signed. Purdue's legal department had minor issues with the contract. And they revised it, sent it to us. You don't have that copy?
I don't think we have the contracts.
Well, let me flash it up on the screen.
Or is it?
I think I've got it.
Oh, okay.
He's got the if approved, he's got the copy
Okay.
signed.
And I'll put it up on the computer.
So in there was just really some minor wording changes. Dollar amount didn't change, anything of that nature. They changed, their biggest issue was the HIPAA part of the contract, because they're not providing any medical services or any dealing with insurance or, so they didn't believe it applied to them, so they wanted it removed. So they removed it, and let me see if I can get to it. They changed some names on the contract. Here's the HIPAA. So it basically says that they're not providing these services, so they took it out. And Ron's reviewed it and said it was okay to move forward with as far as the legal standing of it goes. And they've changed the name from Purdue Extension Office on the signature page to Purdue University. An all-inclusive type thing for the legal department. So the contract has not changed as far as services, dollar amount, anything like that. They've removed the HIPAA part for their particular services, and they've changed some names on the signature lines.
Motion to approve the amended.
I'll make a motion to approve the amended.
Second?
Second.
Okay. Moved and seconded. All in favor?
Aye.
Opposed?
With that being approved, I will get it, have Dr. Ryder's signature on it, and then I'll take it to the commissioners tomorrow on the agenda. I'll have them sign it, and once we have that signature, so Purdue will have theirs, and we should be able to start implementing their programming and getting them reimbursed. So the unsigned contracts, the only one that we had remaining was Purdue. Obviously, we're taking care of that right now. All the invoicing and reporting templates, were sent out to everyone that did have a signed contract. So once we get this one signed, I will send the invoicing and reporting templates out to them. I had a meeting with Reed Hospital this past week over at HFI. And they had some questions on the reporting part of it and what we need from them and things like that. So I think at some point before the end of the year, we'll call a meeting with all of our subcontractors to go over everything to see if they have any questions as far as reporting or if there's anything else that we can do to help them gather those numbers. I know it's kind of, everybody's learning from this, including all the health departments across the state and all the meetings I've been in. Bertha 5, they're we got denied the safety pin grant. So as far as funding, their contract is $100,000. So I contacted the state over the health maintenance fund. It's we have $80,000 in the contractual line of the health maintenance fund. It can be used for Bertha 5 according to IDUH. I talked to them this morning. They confirmed it can be. It can be used for the maternal and child health. There's about 5 different things it can be used for. And I will show you that. So this is the local health maintenance fund, and this is the IC code as far as what it can be used for. And down here is maternal and child health services, including prenatal clinics and well child clinics. So, but these are all the services that we can use that money for. So we can fund 80% of Bertha 5's contract with the health maintenance fund, and then next year fund the rest of the 20% through Health First Indiana.
Is there any discussion?
I guess how much money is in the Health First that we need to spend before the end of the year?
Pretty much all of it. All of the 80,000. We have $147,852 left out of 148. This line here.
Was there anything else we needed that money for?
There was nothing that we have planned for it. So when we filled out the carryover for last year, essentially we had to stick it somewhere, and the most broad spectrum is always in contractual. So that's where it was put. So I'm asking the board to approve a contract amendment, moving the fund from safety pin grant to the health maintenance grant.
The safety pin grant was denied for the next fiscal year, is that it, or?
So the safety pin was a fiscal grant. We submitted a budget last year or the beginning of this year. And when we submitted it, they approved it, but funding subcontractors was not part of the budget we submitted and they approved. So when they found out we were using it to subcontract, they said it doesn't fit the requirements of the contract, so therefore they just denied the grant. They canceled the grant.
Entertain a motion.
I make a motion to approve.
Second.
Further discussion? All in favor?
Aye.
Opposed?
And after talking to the safety pin workers at the State Department of Health, they said there will be future funding in the future. Not only for us to apply for if we choose to do so, but private industry as well. So Bertha 5 could apply for their own grant through the State Department of Health. Reporting for Health First Indiana. We're a little bit behind on our metrics due to the turnover, so we're caught up now from January through August, and now we can start reporting month to month. I'm starting to get some of the reporting in from the subcontractors, but most of what I'm reporting on now is what we have done locally at the health department. So we're getting caught up on that. So on the financial end, we'll move to that. I just brought up the balances for the remainder of the year for all the funds that we have. So the health fund is the county's operating budget. It started off with $827,000, and we still have $319,000 left. About 38% has been unexpended. That's the fund that pays most of the salaries throughout the health department, supplies, office supplies, gas and fuel for our vehicles, things like that. That comes from local taxpayers. Health First Indiana, we started off with $803,000, down to $500, or we have $583,000 left, give or take. We still have about 72% of that. I'm also hearing from a lot of the subcontractors that they may not start sending us invoices until the first of the year, if not late in the quarter. So there's a good chance we'll have a pretty good carryover in that fund into next year's fund. Health maintenance is what we just discussed. Started out with $148,000. We've got 99.9% left of that one. Can everybody see that? Okay, good. Health donations, this is that strange account that was started years ago. It has $7,000 left in it. It started off with $8,900. It's very limited on what it can be used for, but it does have a budget. Immunization grant. So this one's a little tricky. It technically ended, and Dr. Ryder just signed the new contract. So we're waiting on purchasing orders and all that good stuff from the state. So technically now we're in the red in a sense because we're paying for services, and then we have to wait for the reimbursements. Harm reduction is the READ fund, where Reed Hospital gives us money every year to help the SSP program. We started out with $48,000 and we sit with $26,000. 340B program. This one's a little tricky to understand too because the appropriations aren't right, but we had to guess at the beginning of the year of how much money that we would make. So the guesstimation was $695,000. We well went over that. So right now, like I said, we have about $750,000 that can be moved out of the cash line into the appropriations. COAG grant, this is the grant that ended, but the money is ours to spend. Started off with $660,000 and we're sitting with $556,000, about 84% left. This is to primarily help the school systems and things they need, whether it's we're doing outreach and doing immunization clinics, or if we're helping them with plans, or maybe trying to fund an AED for them, whatever the case is, that's what this leftover money's for. The lead grant did end, and we left a positive balance of a little over $8,000. And I'm going to use that money to pay for XRF sourcement, and I'll get to that a little bit later. And then COVID vaccine reimbursement, this has also ended, but we're still waiting on some reimbursement, some of the bills we sent out, correct?
Or which one?
COVID reimbursement. So I believe we have about $150,000 left in that one. So that numbers don't add up. All right. So the next thing is into this coming year's budgets. So you should have those in your folder. So the first one is 1159. This is the one that said it's local taxpayers' money, and this is primarily for salaries. So what we've done in that is every person's salary is put into this fund. Whereas before we paid 4 salaries out of 1161, which is the Health First Indiana. So we've taken those employees out of Health First Indiana and moved them into this line, this budget. And the reason for that is every one of these positions would still be needed if Health First Indiana and every grant went away. We need all these positions to meet our statutory requirements for testing, immunizations, environmental inspections, so forth, so on. So that's the reason we moved them all into 1159. With doing that, we removed everything else out of 1159. All the supplies, fuels, trainings, anything like that, we took it out of the local taxpayers' dollars and put it into Health First Indiana. So there are a couple changes with 1159 over the past few months. If you'll notice the first highlighted section there on 10520. This is what used to be the clinical director. And the new structure, I believe, is going to be director, deputy director. So the director of clinical services has been moved to deputy director of clinical services. And with doing that, HR changed the job classification. So that actually reduces that pay down to $71,546. On the next highlighted line, which is 10906, the only thing that's changed with that is the actual title of the job. We changed it to bookkeeper. Dollar amount did not change. On the third page, 10355, the director's position was removed from the budget, and then we just put it back into the budget. And that is it. That is all the changes that we made for that particular budget.
Again, is the health officer in the other budget? Questions on the changes?
So at the end of that, with all the dollar amounts, we went down approximately $10,000 from what we asked for last year. We asked for $827,000 last year, and we're asking for $814 this year from county council.
I think it needs our approval, but then it goes on to
The council tomorrow night at 5.
I'll make a motion to approve.
Second?
I'll second.
Okay.
Okay. All in favor?
Aye.
Opposed?
It's okay.
So the second budget of importance today is 1169, which is Health First Indiana funding. So our overall balance that we're going to get next year is $1,552,124. So with that said, what we've done with that money is we're all aware that we have 3 positions over there that were contractors with Heartland, and now they're just kind of floating out in no man's land. So we're treating them as independent contractors or de facto employees. After speaking with several people, we have proposed that we make those county employees full-time. That way we can use them how we want. Right now, they're kind of in a line with their programming. Once we make them full-time employees, we can multi-use them. So our COAG person could help with harm reduction. Harm reduction could help with COAG. They could cover front desk, for families coming in. It reduces our liability. So their salaries based off what we currently pay in MA, which is $21.80 an hour, to $45,344 per year. With that too, we would have to pay the fringe benefits on those. So what I have figured into the budget is worst case scenario. So the taxes and liability insurance, Social Security, retirement contributions, those wouldn't change. That's a percentage. What is the outlier is the group health insurance. So worst case scenario, that person we hire full-time takes family coverage. That would bring all fringe benefits up to $82,139. If they go on the low end scale of that and they only take single coverage, it drops it down to $63,000 a year per. I can only take counts on one budget, so my worst case scenario. That's what the first 6 lines are. Medical assistants, their salaries, the next 3 are the fringe benefits that we would have to pay out of that fund. The next 3 highlighted areas, 22,280. This line was created for new computer supplies, laptops, mice, cables, things like that. Mainly for our outreach programs. They're the ones in the field using laptops and projectors and things of that nature. Supplies other is the next line, 22,290. It's just one of those lines that kind of leaves, it's a big gray area. You can purchase a lot of things out of that and it's not really defined. So we had some leftover money, so we put $5,000 into that line. The next line is 22,430. There's $9,000 in that line, and that is to pay for logoed wear, polo shirts, things like that, tablecloths, tents, all that stuff for the outreach programs. And typically we use Logo Shop in Hagerstown. We try to keep the business local. All right, so the next line will be 20200. This line had a lot more money in it. I removed money from that line and put it into a different line to cover its costs. But this line is particularly for if we're hosting trainings, things like that. We can buy donuts and coffee and things. I think $1,000 is well enough to cover that part. And the next line is where the contractual comes in. So that leaves $702,000 to cover all the contractual services that we provide, whether it's subcontracting or anything else. And this is how the contractual is broke down. So as of right now, our remaining balance, for this particular year, 2024, these are the contracts. On the left, you see under there, Bridges for Life, Reed Hospital, and Neighborhood Health. These are only 3 that we're funding out of HFI. The rest of them are coming out of other funds. Bridges for Life was $27,260 for Reed. Neighborhood Health was $188. If we broke that down into an average cost, you can see the average cost per contract, which would be approximately $26,500 per month. We have $337,000 left, so there's plenty of money to cover the next. The next 6 months is $158,000. So essentially, we're going to use half of that $337,000 to cover the Health First Indiana, leaving us with $150,000. So there's plenty of money left in contractual for this year. If we add in next year's total, you can see the balance is there. And I did add in, I'm really not familiar with this. I haven't been part of those conversations with the Stride Center, but I'm guessing that dollar amount's close is what was been discussed.
Mm-hmm.
Okay. So if it gets approved, we funded all that in, and that would still leave us $467,000 and $820. So with that said, this money here would be used to fund the MAs. That's where that money was pulled from. So our original $988,000 that was in contractual for 2025 is what you've seen with the first budget. We removed the salaries and the fringe costs from the contractual line and moved it into the MAs and fringe. So we went from $988,000 to $702,000. So what I'm trying to get at there is we have plenty of money contractual to cover 3 full-time employees and still cover all of our commitments to our subcontractors, plus some. So you can see here.
There's been some talk of even expanding some of the subcontracting, so we have some room to do that.
Correct, yeah. So in the companies I spoke to, even if we had full-time employees, they could provide us staffing if we had a couple clinics that we didn't have staffing. If we're running multiple clinics at one time, they can send us staffing for those. They don't have to be full-time, 20, 40 hours a week type things. So this is the MA costs I put on here. As you can see, the family coverage with salary was $82,000 for 3 employees. That'd be $246. If it was just employee and spouse, you can see the numbers here, and so forth, so on. So MA cost is $63,000 with single family coverage or single person coverage. If we was to approve the 3 full-time employees, we would offer, if the board approved, the 2 current independent contractors that we have, the full-time positions. Okay. So without getting too into their life there, both of them would qualify for that line. Because as a county, we have a spousal clause in our insurance. If your spouse can have insurance, they must get it. And we don't provide secondary coverage anymore. So the 3rd employee would be the outlier as far as what they would want as far as medical coverage goes. And then also we took $40,000 on the next line below for the health officer. I was informed that we were giving the health officer's position a raise to $40,000 a year. Is that correct? So that is what's in that line there. Still leaves us the $702,000. The next line is postage and freight. Remember I said I took money out of the food line? I moved some of that over to the postage and freight because postage is expensive. And we send out a lot of mail, especially the environmental side. We have to send out official orders, and those have to go certified mail. So those at minimum depends on how much paperwork's in there. At minimum, it's like $5.80 to send out a certified letter. And with that said, we sent out a certified letter and a first class letter to ensure that the letters get there. So it's $7 every time we send out an order. So I think we only had about $1,200 budgeted this year, and we surpassed that. We removed the petty cash line. Didn't feel petty cash was necessary. Zeroed that out. Travel, lodging, and meals. There's going to be a lot of trainings coming up this next year through Health First Indiana, some of the requirements that they have imposed. So we bumped that up a little bit to cover that. On the next line is contractual software support. We had a meeting yesterday with a company called SoftWorks, and they are a company that does financial software for businesses, mainly government. And another county agency, the County Highway Department, uses this software, and it helps them clean up their budgets essentially. So instead of creating 12 or 13 spreadsheets for the 12 or 13 budgets we have, you just go into this software and it does it for you. You don't have to keep track of it. It doesn't allow you set your appropriation. If the appropriation is $100,000, it doesn't allow you to spend past $100,000. If you try to enter it in, it pops up and says you don't have the money basically. So it would prevent any overages on spending, and it would help clean up the financial part of the health department itself.
It also works with the county's current system. And it even has the potential, if the county chose to do it, to even dump reports directly into the Lowe's,
Lowe's.
system, if they decided they wanted to do that, so.
Yeah, as of right now, if we want to pay something, we fill out a claim on a PDF, we print it out, we sign it, and then we scan it to the auditor's office, and then they go in and manually enter it into Lao. If the auditor's office would allow it, this software could connect with theirs, and she could essentially submit it online.
Mhm.
And then it would automatically plug those numbers into Lao, and they wouldn't have to manually enter it. So
Allowing you all to be more efficient and
efficient, tracking, less paperwork. I
Right.
mean,
more
it's,
time to commit to other things.
Mhm.
I spend probably an hour and a half, 2 hours a week on claims.
At least.
Just signing claims, reviewing them with Lau, make sure that, so and that's just me, it's not, including what she puts into it, so, it would be beneficial.
Usually takes me about an afternoon to get them done
Yeah.
correctly.
So that's in there in the budget, and that's the reason we moved money around for that.
It is the license and the training fee, is that under the 1161?
Yes, for the SoftWorks. Or the training for the departments.
So the one, you bought the software with a one-time fee, and then there was an annual
Yes, so
fee.
the software itself was $7,995. That's a one-time purchase. And then you pay an annual maintenance fee of $1,995, which is reduced for us because Wayne County as a whole is already a customer. So if we were a new customer and the highway department didn't have the software, that was actually closer to $3,000, if not $3,400 for the maintenance contract. So we pay the one-time fee of $7,995 and then the $2,000 each additional year. And that money would be pulled from Health First Indiana funding.
And that was for three
3 users.
users, which
So-
we thought was adequate.
Essentially, you only really need 2 on our end. You need the director and the bookkeeper, and then the third could be a backup, whoever the director wanted to be a backup. There would be no need to have more than three users. And training and education. Reduced that cost just a touch, and it was up around $20,000. We reduced that to cover other lines. That is all the modifications that we done to Health First Indiana. So there's 2 options here. 1151 is, we really didn't make any edits to it, as you can tell, other than some wording in one. 1161 is the one that we made the most modifications to, and Kathy and I worked on it together. We come up with a couple versions. This is the version of 1161 that I would prefer as a person in charge. I'd rather have control over a person as far as dictating scheduling and all that stuff than have contractual. But if the board doesn't approve it, or council for that matter, the backup plan is taking those 3 positions and moving that money back to the contractual line and then hiring one of these companies to do it. So Vergence is one of the companies that I spoke with. Both companies are out of Indianapolis. And this is their proposal. I believe I sent everyone an email too with this proposal in it. This is kind of given their statements on what their company's about. So here you can see, oops, not too good with my hands here. Their staff comes to us already trained with the professional licensing certifications. They can provide us medical assistants, physician assistants, nurse practitioners, LPNs, RNs. All Vergence employees placed on a contract assignment are covered by their medical malpractice insurance and all the other state of Indiana insurance requirements to provide staffing. So we would only have to pay the bill in a sense. They take care of all the recruiting, all the benefits. They offer competitive pay and benefits. They offer insurance to their employees. They do ongoing recruiting. And then we get down to the money part of it. So we get, as a county, get to pick the base pay rate. And that is $21.80 an hour for the MAs. And the reason I set it at that is that's because what our current full-time MA makes. So I didn't want to make them above or below that. So you take the $21.80 plus the 35% is what it comes out to. And that was your $61,800 is what it come out to per year, per employee. And there's no, I asked them during the proposal process, and they can't tell me as far as how long a typical person stays. You know, so if they place an MA with us, they don't have retention numbers in a sense to say that that person would be here a month, a year, 2 years. Because I told them we don't have the intention of going from temp to full time. It's truly a contractual type thing. So there's no guarantees.
What if you contracted with them for a lesson and down the road, we decided that we wanted to hire that person instead of, and they wanted to work for us? Can they allow that, or are they blocked?
They do allow that. Both companies allow it. So really the only difference though, the company that I heard from this morning was called Knowledge. And both of these companies were recommended by the State Department of Health. The State Department of Health used both of these agencies during COVID for COVID testing. Indianapolis Speedway, if everybody remembers that big testing thing they did there, these two companies were utilized during that. The mobile units for the State Department of Health, these two companies are used for that. Emergency Preparedness, the division of the State Department of Health, they use these companies as well. So they're both very similar. The only difference between the two is Knowledge wouldn't actually tell me the percentage, but they said they were pretty much identical as far as the 35%. But the only difference of the two is Knowledge, the second company that I don't have paperwork on yet, won't charge us the 35% if we've done the recruiting end of it. So if I say, hey, I want to carry these two employees over, that 35% goes down just a touch because they didn't have to do the recruiting. So, but I don't know those numbers yet until they send me the proposal. So what I'm asking the board to do for me today is to approve the 1161 budget with the 3 full-time employees.
And the increase in pay for the health officer.
And the increase in pay for the health officer.
It's all included in that budget. If we approve the budget with those in it, do we need a separate motion to approve?
Moving the budget as modified.
As modified, but there's also the Virgins, or not the Virgins, the SoftWorks proposal we got yesterday. I think you'd probably have to have 3 motions. You'd have to have a motion for each one.
Are you ready to approve either of those without the final working from the company that you just talked to today?
No, we can break it down. Let's break it down to whether we recommend the hiring of the 3 MAs as proposed in this budget.
Or the contractual.
The advantage of the hiring is Dan feels like it just gives him more flexibility and a little more control. And to be quite honest, we've had some problems with contractual workers.
Correct. We've also, the last year, I think the county was not necessarily receptive to expanding county positions. So
They weren't.
yeah.
I think some of that's just changed and, kind of the situation we're in now, some of the things that come to light. I can't guarantee that.
Yeah.
But if the board approves it, then I will most definitely take this budget before them tomorrow night and ask their permission for it. And if they deny it, then I'll go back to the drawing board and we'll redo it. Yeah, the other budget's prepared. I just didn't bring it.
Yeah.
in hopes this one gets approved.
Didn't you say Virgin's employees have health insurance through Virgin's?
They're offered health insurance if they want it.
Okay.
So they would, and that would be included in the 35% markup.
I'm sure it's probably expensive for the employee, but our 35% is just that, 35%. So, and it would be an hours work type deal. If they worked 45 hours, it'd be 35% of that 45 hours.
Discussion? I entertain a motion to ask council to approve the positions as employees.
I'll make a motion to approve.
I'll second.
Further discussion? All in favor?
Aye.
Okay, motion carries. We need to discuss the health officer increase in salary, or is that just in the budget?
It was in the budget, wasn't it?
That's in the budget.
That's-
Just
59.
approve that in the budget. And then I think the software package, approve that.
Yeah, I think you ought to take a motion on the software.
I attended the session and I was impressed. I mean, these guys have been in business for 40 years and their specialty is government. Helping management software, and they really do highway departments. It's just, they have the highway department stuff down to a science. But we're looking at the bookkeeping aspect. And they even said that they'd work with the auditors and they will tailor, if you come up with an idea and they agree, that they'll tailor it to you. So they said among all their counties, no one's the same. Because they're able to tailor it to what your auditor, what your county, what your systems need. So I was impressed with them.
And that's all included in that $2,000. There's no extra charges for beyond that.
We also know that we have a county department that's using them and is happy with them and it's successful with that software. So I'd entertain a motion that we ask to purchase that.
I'll make a motion.
I'll second.
Second?
Yeah.
All in favor?
Aye.
Opposed? And then the next motion would be approval of the budget as has been presented.
I will motion to approve.
Okay. For a second?
Second.
Second. All in favor?
Aye.
Aye. Opposed?
So the last part of the financial part of it is some of the swapping of the positions and all that stuff this year. How do we fund that for the rest of the year? And we try to fund it out of the same fund instead of pulling from different funds and stuff. So the director's position, we have 9 pays left for the year. The director's position would require $3,200, essentially each pay, totaling $28,925. We have $5,000 remaining in that line right now. We used it for other means. Deputy Director of Clinical Services, 9 pays again, it's $3,077 at this year's rate, which is $27,700. Remaining in that budget, that line item is $33,857. So to fund those positions for the rest of the year, we need $56,000. We have $39,000, and so the difference is $17,326.99. So we can pull this $17,326 from a part-time position that we had, a clerical position. She was scheduled for 20 hours a week, but she rarely worked but 15 hours a week, and she just resigned a couple weeks ago. So there's money left in that that position. If I was to hire someone today and pay them the rest of the year, I would still have a surplus of $16,962 in that line. So that is a surplus. Overtime budget, all within 1159. We have $1,800 left in that budget. We don't have anybody on overtime. Everybody is comp time. So that money would not be used as well. So it could be used to fund those positions. 22,130 is the medical and dental supplies. Going off the percentages that we've used so far, we will have at minimum a $5,000 surplus in that account because we've supplemented with 1161 to help First Indiana for a lot of the supplies. In the public education info and training, we have money left in that account, and we could, with the percentages, we could pull $2,000 out of that account and fund those positions, still leaving us money in that account for any public education info and training. So out of all those funds that I just mentioned, that gives us a total of $25,762 to fund $17,000. So we have options. We got $8,000 remaining, basically. So with the board's approval, when it comes time to fund these lines, do I have the board's approval to use these lines I mentioned to supplement the other ones?
Questions?
I know it's really confusing. There's a lot of lines and a lot of numbers.
Do you have to have council's permission for those transfers?
The first two, no. So that I can transfer from 1,000 to 1,000 without council approval. The 2,000, yeah, I'd have to have council's approval to transfer money from medical, dental supplies and the public education to the 1,000 personnel lines. So I would need their permission for those two transfers, but not the first two transfers.
Dan,
Yes.
you might want to recheck that. I know the auditor's office thinks you don't have to have approval, but I would check with Beth Leisure on that, just to make sure.
So according to the auditor's office, I don't have to have permission for 1,000 to 1,000, but I will verify that with council.
Do you need a motion from us?
Please.
I appreciate the fact that you will take into consideration each line and the effect that it would have if we were to approve. So definitely appreciate that.
Any further questions?
Are we currently employing the deputy director of clinical?
No.
No.
So right now we have the director's position vacant and the deputy director of clinical services. Now the deputy director of clinical services essentially doesn't happen until next year.
Okay.
So right now it's still director of clinical services, but to my knowledge.
And what I would just say is that particular position, that particular person who just resigned also did not necessarily meet all of the afforded hours. And so I assume that within the office internally, adjustments have been made to still meet the mark. So.
Yeah, as far as our admin goes right now, it's being handled. Things are getting done on time and things like that. As far as the vacant position and the clerical side of it, I have other people helping out to fill that. I did receive an application today for that part-time clerical position, so I'll give it a week or so to see if I receive any more, and we'll conduct interviews. But like I said, even if I fill that position today, I would still have a surplus of almost $17,000.
Yes, sir. Thank you.
No further questions? Entertain a motion.
I'll make a motion.
Second. All in favor?
Aye.
Opposed? Carries.
Dan, can I ask one question?
Sure.
Is this gonna fix that legal services line that you needed to transfer and fix?
That is being fixed out of other lines, like you and I discussed, this says, this will have no effect on that legal services line, yeah. And what she's referring to is we have a lot of things to take to council for moving money around, correcting lines, all that good stuff. And one of them was legal services. Some money got pulled from a fund that didn't have a legal services line, so we're trying to correct that. IDOH, April Kendricks is her name, will be here on the 22nd, this Thursday. She's gonna meet over here at the 100 South 5th location. She is the finance person for the State Department of Health, for Health First Indiana. So the approved budget that the board approved today and hopefully the council tomorrow, I'll take to her, and hopefully she has no objections to it, so we don't have to do this again. Anybody's welcome to attend that meeting if they want to do so. I said earlier, Dr. Ryder did sign the immunization grant, so we're waiting on purchase order and final contract. We talked about the safety pin grant. There is 3 options with that. Just make sure I put it in there. I may not put it in there. I believe I forwarded the email to everyone. So there's 3 options with the safety pin grant. We can essentially move forward with the safety pin grant as we have it, as the contract stated and was signed, and not do subcontracting with it. With that said, we would then have to either hire more inmates, or we would have to use a contractual company to staff that part, the safety pin part. The state can revise the contract, and we can go through the process again. That could take 4 to 6 months. So by the time it gets done, we're potentially halfway through the grant cycle. Or we could just not reapply for the grant and use other funding to fund Birth to 5 and that program until other funding becomes available in the future. So my question to the board is, which direction do you want to move with that?
Well, I mean, we were using Birth to 5 to provide that.
Right. My opinion is that with the health maintenance fund in place and having permission from the state, essentially we don't need the safety pin grant at this point. So I think it's just another budget we have to worry about that's not necessary.
And we're not closing the door on it forever. I mean, that's.
No, not forever, just the cycle.
And we already decided that we have the means to fund.
Correct. Birth to 5s.
Which we approved. So in essence, we've already approved funding Birth to 5.
Right.
The alternative method.
Mhm.
So is there any? We need a motion not to approve or just let it?
I don't think so. I mean, it's already been canceled by the state, so there's nothing to move forward.
Is there anybody who wants to apply? Us to apply.
More information on it than anything else. So we discussed the SoftWorks financial program. I did speak with our IT department as well, and they would have no objections putting that on our computers or the software. Move on to staffing. I did have a meeting with Manpower, and he's not ready to move with contractual type medical positions. He is exploring it for future business as far as gathering the insurance and stuff. So we did try to go local to get those contracts. We talked about the companies out of Indianapolis. As far as our independent contractors right now, we have paid them out for all the quote-unquote comp time they had. So from moving forward from this point, they're getting paid for hours worked. If they work 40, they get paid 40, 45, they get paid 45. All right. And then the last part, as far as contractual goes, is the amendment of Dave Wolf's contract, the physician assistant.
And we met in executive session to discuss that. And reached the conclusion that we would terminate that contract. Is there a motion to that effect?
I'll make a motion.
Second?
Second.
All in favor?
Before you do that, a couple things. You're terminating without cause, so you have to give 15 days notice, which means the contract continues for another 15 days and payment is, he's entitled to payment for that period. He can be relieved of service during that period of time. He doesn't have, that, I don't know if the department has a feeling about that or not, but those are your nuances to it.
It gives us a little bit of time and gives that person some time to adjust.
Does that 15 days include today or does that start tomorrow?
Doesn't say, but I think it'd be the notice is given to him, so it says 15 days notice, not 15 days board action.
So the motion would be to not renew his contract.
We're just terminating it, as you've had the right to do since March of 21. That clause has been in there.
All right.
I think we had a motion. Do we have a second? Second. All in favor?
Aye. All right. The FEMA program, we know the coordinator's been vacant for quite a long time now, after Dana Smith left our employment. So our part-time person, Cynthia Blue, has been handling both essentially the full-time and part-time position during part-time hours. She expressed interest in taking over the full-time job, and it was offered to her, and she did accept it. So we are moving her into the full-time FEMA coordinator's position, and then we'll put out a post for the part-time position, or request the hire for the part-time position. She does really good work, and she's very, very organized. As far as programs go, the harm reduction SSP program, it was moved from the health department's site there at 100 South 5th to Centerstone. It's hosting, I believe that was the original location at 100 South 15th Street.
100 North 15th.
Oh, sorry, 100 North 15th Street. And it's gonna operate on Tuesdays and Fridays from 12 PM to 1:30 PM. I believe this is, allows the participants to get services quicker. I believe it was one of those days we have people on site from Centerstone for referrals.
Yeah,
So
we have same day access intakes on Tuesday and Thursdays, so having them at the building makes it so where folks, if they wanted to get into treatment, could get started the same day. So, yeah. And I believe that started today. I saw folks piling in this morning, before I left, yeah.
I think that's an improvement.
Mm-hmm.
That worked to the original intent.
And let's see. Is there any questions on that reduction program? Vaccines, flu and the new COVID variant vaccines possibly shipping mid-September from the State Department of Health. So as soon as we get those, we'll start implementing.
So will one be well advised to wait till the new COVID variant vaccine's available?
Yes, because the ones that we have 5 on the shelf in the health department right now, 5 vaccines, and those are not effective on the most current variant. Animal bites, kind of what we started off with today. The bat tested positive for rabies. To our knowledge, it had no human contact. Reed Hospital was advised. It was found at a West Side school. And I don't want to release the name of the school because I don't know if the admins had enough time to contact parents. But I will tell you after the meeting if you want to know. But we've not had a rabies transmission in a bat, a positive test since 2015. So that tells you a lot right there. We are educating the school. Luke Remsnyder, our animal bite inspector, he is on it, writing letters and meeting with the admin. So as you can see here, this data is a little old, but it still applies to today. Bat rabies cases, they always spike in Indiana in August for some reason. There's approximately 10 to 20 rabid bats detected in Indiana during a typical year. Only a small number of the 2,200 bats tested at the local, or the IDOH laboratories during 2016 to 21 were positive, so 3.2 positivity rate. As you can see here, most of Indiana has bats, rabid bats. And the last rabies cases in Indiana were in the 2000s. 2008 to 2009, that's the last time there was a bat to human transmission. So, sounds scary, but it's really not. The odds are very low. And in the animal bite division for our department, we ship off 5 to 6 bats per year, probably. Probably the same as far as canine heads. Other farm animals as well, if thought to be rabid. So it's something that we do at the health department and a lot of people's not aware of. A few more things need approval for. I promise I won't let you go. First one I want to talk about is cabinets for the birth and death, vital records. People are not aware, we house all the vital records for Wayne County dating back through the 1800s. And most of that is on paperback book. As of right now, our storage is on typical metal shelves that you would get from Lowe's or Menards, and all the books stand vertical. So we pay every year $2,000 to $3,000 to have books rebound. And they're starting to fall apart. So that cost is going to increase eventually. So we explored several different options, and one of the options that we come up with was provided to us from the county clerk's office because they obviously store a lot of records, and it's for these particular shelving units. You can see here on screen, they store the books horizontally, and they don't put pressure on small parts of the book to make them fall apart. They're easier to access for the employees. These shelves have rollers on them, so they're able to just roll the book out instead of pulling a shelf out. And they stand vertical as they appear in this picture here. Or they can stand horizontal. So, and the space that we have and the dimensions that we have, we would have to have both horizontal and vertical type shelvings. We can put all of our historical books in here and some other documents that we have that's historical that aren't particularly books, but we can put them in file folders and put them in these units as well. So I think they are beneficial. They would preserve our books over a test of time, and I think eventually we'll spend less money on the rebounding part of it. With that said, they are expensive. They're $14,322 for what we need. $927 of that is for the freight. These things are very heavy duty. They do come 95% assembled, so there's really no assembly once they get here. They'll show up on a freight and they're going to have to be dollied into the position where they would finally sit if approved. So I'm asking the board's permission to buy these for the registrars to help them. And here are the options for buying. So in Health First Indiana, we've got field equipment, $8,000. Same thing with capital expenses. We purchased a vehicle this year with left us $5,100 left in that budget. There's no intention for any other capital expense to be bought this year. Field equipment in 1168 with the health maintenance fund. There's $8,000 left in it. And then $33,000 left in the COAC supplies other line, that line that is the big gray area that you can pretty much spend anything on. So if approved, we have a few funding sources here. A couple of them would have to be combined to meet that cost. The COAC could cover that cost in one fell swoop. There is money left in 340B, but with all the changes and things like that we're potentially making, I didn't wanna touch that. There's no more than we had to.
Would such shelving eliminate the annual maintenance calls to rebind the bulk size zone, is that right?
It would eventually, I believe. I don't think it's going to in the first week. Our books are in such bad shape, we can only send so many off per year. But eventually in the long run, it would take that budget down to zero essentially. We'd still budget for it just in case something's dropped or somebody from the public tore something, but it'd be unlikely to spend it.
Now, I assume those go inside the fire resistant room.
Yep.
And would these be
Keep those in
efficient
paper.
storage or?
Do you have to keep those in paperback form, or I mean, in the perfect world, could they be digitalized?
It could be digitized, but we would have to keep the original record in its original form
Somewhere.
somewhere. So we could, if we had the money to digitize it and then
It's paper.
We'd still need to keep these books.
vacuum seal them or however you hide them away, I guess, but yeah, we'd have to have the original as a backup, but we could digitize them if we had the capability, and that'd be a lot easier. Then you could just put it on your website and the public could research it at will instead of them coming in, taking the books at the table, going through everything, so that would be beneficial, yeah.
Now, as far as space occupation in that room, are they about the same, take more room, or more efficient usage of space, or?
I wouldn't say it'd be more efficient, but it wouldn't make it any worse. It would be the same amount. We measured the cabinet size, obviously, and then we also measured the cabinet with the rolled all the way out to make sure we didn't impede with the shelf behind us or whatever, the door. So they will fit in there and they will be functional. It's not gonna increase space, but it won't decrease space.
Further questions? Entertain a motion?
Motion to approve?
Second.
Second. All in favor?
Aye.
Opposed?
So the next one, the board has already approved essentially at the beginning of the year, but I wanted to bring it back up because we're shipping it out. And this is the XRF. This is our machine that we use to identify lead hazards in homes through paints and walls and tiles and things of that nature. I don't know why it will not pop up. So most of this will be funded out of the lead grant. We have a little over an $8,000 balance in the lead grant that we have to spend essentially, so we can close that grant out because the grant ended. And then the rest of it would be funded out of 1161 Health First Indiana, and that money was already set aside in Health First Indiana. Actually, the full amount of we budgeted $12,000, I believe, in Health First Indiana this year for it. So actually, I'm only gonna be using maybe $2,000 from that. So it's a total cost of $9,500. Now, this does not have the shipping on our cost in there, so there will be an extra $200 for shipping because it has radioactive material in it. And that's the reason we have to get it resourced. That radioactive material has a shelf life. And as it sits on that shelf, it decays, or every time we use it, it decays. It's essentially an x-ray machine that's shooting through the walls and telling us how much lead's in there. It's very expensive to ship and very expensive to resource, but it's a necessity of our duties. We do approximately 15 to 20 lead cases a year. And we've been in conversation with a couple other smaller counties, Union County, Randolph County. They don't have any licensed lead risk assessors, and we've been in communication with them. The infancy stages of communication to where our lead risk assessor may be helping them out for a couple cases per year. That way they don't have to pay for the training and all that. And they would reimburse us for our services and things like that.
Questions? Motion to approve?
I'll make a motion to approve.
Second.
All in favor?
Aye.
Opposed?
This one. If people are not aware, our coroner resigned
Right.
kind of abruptly. So, with doing that, the coroner, as a coroner, they have access to what we call the OneDrive system. And the OneDrive system is what our registrars and vital records use to pull up death and birth records across the state. You have access to everybody's records across the state. I have no idea what that's doing there. But with that said, we need to remove the former coroner's access to the OneDrive system because he can still access all the personal identifications in those records. So we contacted the state and they told us that we would have to have a signed letter from our health board president stating that we wanted Mr. Foucher's access permanently denied. They did temporarily remove his access from an email that I sent him, but to have it permanently removed, it needs to be signed by the board president and approved by the health board. So this is
Need a vote for that, no, do we?
Yeah, you
Need a
gotta,
vote?
yeah,
I gotta sign it.
to remove his access from OneDrive.
I assume this is standard operating procedure when,
I don't know, that we've never had one resign midterm, so typically when they leave office after losing an election, that's part of the process is they.
so when someone's not in the office, it's standard procedure to remove them
Correct.
from this.
Correct.
So it's nothing unique, it's just,
It's not unique.
it's just instead, he resigned
It's bad
instead
timing.
of retiring or. Entertain a motion?
I'll make a motion.
Second.
All in favor?
Aye.
Aye.
Opposed? So you draft the letter, I'll sign it.
You have one in your folder. All right.
I believe that position's been replaced, hasn't it, by the caucus?
Have they already had a caucus and replaced it?
I think it's later this week.
Is it later this week? Okay.
I know Tim Brown's running things kind of right now, you know.
Oh,
in absence
okay.
of, in the absence of a coroner. And he already has access to OneDrive, Tim does. As far as the environmental sides of things, the house on South Fifth Street, they're just south of the health department. The owners have been compliant in the last 3 weeks and have vacated the home. That's a good thing. And food, we continue to receive temporary applications. For some reason, we are up 44 permanent food restaurants in Wayne County just this year. So we essentially have, give or take, 400 every year on average. And we only normally have about 15 new establishments come in. This year, we've had 44. So it's a food booming county, I guess. Saturday night, I was called out to a local food establishment for an emergency CO2 canister. It was overpressurized, kind of not exploded for lack of better terms, but it busted. The employees didn't know what to do, so they pulled the fire suppression device, which sprays fire suppression foam all over the place. So went in there and had them, gave them directions on cleaning up, and then Jason Howard, our food inspector for that particular establishment, went back the next day to verify it was cleaned up. And I believe that is all I have. Are there any questions for me? I know it wasn't a joyous meeting, it was kind of long. And I guess my next question is, do you guys computer or would you prefer to have paper?
They worked well.
Yeah, computer.
If there's something important like the budgets, I think it's easier to follow along on paper than me trying to scroll through, but hopefully next meeting there's not as much to discuss and there's less things to pull up.
At the next meeting on the 17th. And before we adjourn, we got, I think I've seen now, just got another one today, 4 applications for the director's position.
Okay.
So I'm gonna check, but I think we'll need to start interviewing here very soon. So I'm gonna talk with Kim about exactly what the process is, and we'll be talking to some of you about what we do. So how do we do that without having a full meeting? Just can 2 people do it at a time, or 3?
Well, I don't know what your process is gonna be. Have you talked with Kim and HR? I mean, has it been posted?
Positions have been posted. We've had 4 applications now. And I think we reached the time to where we can start interviewing.
Or reviewing the applications, you know, that narrow field or not. You can have an executive committee handle it, but you can do it in the executive session as far as the applications can go, and you review. Any final employment decision had to be made in a public meeting, obviously.
But we can hold an executive session to do interviews and review, but the motion would be in a public meeting.
Are you gonna do it as an entire board, or are you gonna have an executive committee that kind of screens it and makes then a recommendation to the board? I mean, there's no legal right or wrong, it's just practicality.
We've had a personnel committee in the past, and we could use that, but I think I may reorganize that a little bit. And so I would like at least 3 of us to be involved in the interview process. And I don't know, it has to be the same 3 every time we interview. It would be help to have some continuity. Unless the whole board wants to do it. I mean, I can.
I was gonna say the board, you know, poll your board and see what their interest is.
Yeah. So why don't we, if I get with Kim, we'll get it set up. And so when we interview, I'll just notify everybody on the board and whoever can attend. Can attend, and we'll do it as an executive session.
Perfect.
Has there been any applicants for health officer or any decisions about that?
No decision on that yet. I thought, one, it's awfully hard to talk to somebody about being health officer. And I wanted to see if the pay, the stipend gets
Approved, okay.
And so I thought, I think once we have a director and then the stipend approved, then we start getting a lot more aggressive about finding the health officer.
What does that make the total pay for this health officer?
$40,000 a year.
That is, that's what was,
Total, it went from 25 to 40.
Any other questions or comments? I'd entertain a motion to adjourn.
so moved.
I'll second that.
Second. All in favor?
Aye.
Thank you, everyone.